the next 2 hours is going to be ethics and professionalism.
Oh, really? Did you take all my crap up?
Again, Zirkle can't be here, so Mike is taking over. Turn it over to Mike.
Why did you do that?
Ethics and EMS service primarily focuses on principles of beneficence, doing good, non-malfeasance, doing no harm, autonomy, respecting the patient's choices, and justice, which is fairness. Ensuring that all patients receive equal and appropriate care regardless of their circumstances, while always prioritizing patient well-being and respecting their right to make informed decisions about their treatment. EMS should always provide services based on human needs with compassion and respect for human dignity, unrestricted by consideration of nationality, race, creed, color, or status. To not judge the merits of patients' requests for service, nor allow the patient's socioeconomic status to influence our demeanor or the way we care. I don't know how many times y'all have witnessed this, actually. You know, we used to have an individual that worked at this facility, and his mother would come in to the ER, and every nurse that worked in an office or on the floor was up in ER because it was his mom. Now, they didn't do that for Joe or Mary that we brought in off the street. There wasn't 16 nurses up there waiting to see how they were doing. And, you know, we treat all our patients. We treat all our patients the same, whether it's some crackhead or some multi-millionaire. Patient's going to get the best care they can get when I'm there. I don't care what their economic status is. I don't care what their social status is. I'm going to treat my patients how they need to be treated. You're going to get these patients that, yeah, they're going to cuss at you. They're going to spit on you. They're going to try to wipe their blood on you. Does it get personal? Sometimes it shouldn't, but we all have our breaking points. You just got to take a step back, take a deep breath, and go back into doing it. You can't let a person being a butt cause you not to care and take the best care of it. Ethics is also defined as doing what's right, no matter who's watching or who's around.
So let's go back to the, and I understand, I think David has a little bit more, he's good at compassion on certain patients, especially this one. Bondwood.
Yes, ma'am. I don't know who we're talking about.
Ethics and professionalism. And I understand it's, don't throw anything at me. I understand it's an ugly situation. It's redundant. It's annoying, but there is something that is viably wrong.
Correct, but she will not stay in the facility and get it fixed.
I know.
I personally think it's a money grab.
Well, that's not good.
I don't care to go out there. I don't feed into it. It's more of a, I don't know, when she starts spiraling, I don't acknowledge it, kind of like a child throwing a tantrum.
Right.
I'm still empathetic and I'm still polite.
Right. We don't know what's going on in her head.
Right.
And I don't think it's as severe as what sometimes shows.
And it's an easy run. I mean, let's just be honest. I mean, we could be at the base, sleeping or whatever it might be. They were asking me the other day, like, what is this house about? Well, I've never been out there in the middle of the day. It's always late at night after dark when I go.
Oh,
I've been there in the day.
I've never been there in the day. My times it's been between 12 and 3. Yeah.
That seems to be the worst of it, whenever symptoms kick in the hardest. Supposedly.
Could it be sundowners? And like a
I
early,
wondered that myself, but
It's her mom.
she's not old enough to really have the sundowner thing yet. Was he? That's 55 and over.
I mean, I really believe it's her mom. 'Cause when
Oh,
they lived in Mountain Home, I looked up, and I personally, that's just me and Fowler, and we run under 172 times.
Yeah.
Then run her out of Mountain Home.
she used to live down here on Oak.
They run her out of Mountain Home. Then she went over to Izzard. Izzard walked in and told her, "Hey, we're done with this crap.
Yep.
If we come back, you're going to jail." Then they moved from there, went to another place, and I guess they're down where they're at now on. And it's got to where now the deputies, I've even talked to them, is you're tying up resources for no reason.
Well, I mean, we've
Right.
had several do that. Look at my stalker up here on Juniper Prairie. She still ain't quit.
Your stalker.
Yeah,
I think that one is in love.
yeah,
With you?
yeah. All because I treated her fairly and, oh, you're the best man
Uh-huh.
ever.
Yeah, and I went and run on her and Fowler. She's like, "Who are you? You're not him." I'm
You're
like,
not him. Get out of there.
Are you serious?
Yes.
"Yeah," and I'm like, "Well, you know what? Cool."
That's not very professional or ethical.
Yeah. To add insult to injury, she wouldn't go unless it was me and Randy. She wanted to fight Randy for him having to be in the back. Wanted me in the back with her. Randy's like, no, that's against the law. Can't do it.
How old is this woman?
She's
It's
32.
being male.
32.
Okay.
She's old enough to know better.
Yeah.
Too dumb to care.
Yeah, exactly. We get her in here, take her to ER.
Have
They
you
put
told
her.
her you're married?
Yeah,
Is she still?
I don't care. Tell her I'm better than she is. Get her in ER. Won't stay in the bed unless I sit in there with her. So to help Rachel and cut down on the goofiness, I sit on the side of the bed. You need to hold my hand. No, I don't. It's COVID season, and we don't need to be doing that. Hold my hand. All right, here you go. Rachel opens up all the blinds and all the curtains. So it's like a movie show sitting there. Fouts comes walking in, singing the greatest hits of Neil Diamond. And he said in there, well, Rachel,
Did you say Rhinestone Cowboy?
that's been coming.
Okay.
Rachel is out there just cracking up. And I'm like, I'll get even with every one of you. Not a problem. Kristen comes busting through the door. What are you doing sitting in here holding her hand when you and I are supposed to be dating? Blah, blah, blah. Chickadee's eyes turn coal black. And she starts standing up out of that bed. And I'm like, Kristen, leave now. No, you're not going to be sitting here holding her. I said, Kristen, get the crap out of here. I said, we're fixing to have problems.
Am I in trouble?
No,
And
not at all.
got her settled back down and calmed back down. And I was like, okay, look, I got to go. We've got Randy hit the door. He's like, we got to call. I was like, okay, I got to go. We got to call, you know. Well, you're coming back, right? I said, I don't know. Depends on where I got to go. They fought her for an hour after we left because she wouldn't behave. Finally called the deputies and they come and arrested her.
Yeah, I kind of know somebody like that too.
I got arrested one time. Leave me alone.
No, I'm talking about the little psych we had in here that I had went in there and talked and calmed her down. And just because you knew her, you thought it'd be a great idea to go in there and talk to her. So you walked in and talked to her.
Habit.
Yeah, you walked in and talked to her. The next thing I know, I turned my back and she goes running out the doors, butt ass naked, and falls in the ambulance bay. Face
Naked.
When you can see everything God give her, when the gown went up. Okay.
And it was I had a reason going in there.
No, you didn't.
Yes, I did.
You just gotta have trauma class.
Oh, traumas. Everything gets cut off.
EMS and legal issues. Informed consent is very important when treating any EMS patients. Without consent, it's unlawful to touch anyone regardless of your profession. Informed consent. Without consent, it is illegal to touch anyone regardless of your profession. So if you want to file charges on the midgets there, go ahead. She touch it.
Well, so when we roll up to the scene, we gotta ask permission to touch them?
Yes.
Yes,
It's true. Pretty much is what you do.
It's implied if they're unconscious.
if they're unconscious, it's
Bleeding,
implied.
you know.
And we'll have some more on that tomorrow when the man from the Jehovah's Witness Church comes. Doing right, the four principles are autonomy, respectful of others, beneficence, doing good, non-malfeasance, do no harm, and justice, be fair. They pretty much hammered this all the way through here. Ethics and EMS, 10 things you need to know: autonomy, informed consent, confidentiality, beneficence, non-malfeasance, justice, respect for persons, and honesty. Ethical challenges arise in three interrelated contexts when caring for patients in the pre-hospital setting. And those three challenges are language barriers, social beliefs, and religious beliefs. Everyday EMS personnel are faced with ethical dilemmas. You must consider the patient's values and professional dignity. We used to have a man that lived in Mammoth Spring. His daughter had cerebral palsy and also seizures. And we would try to minimize her exposures whenever we ran on her. And he thought nothing about undressing that girl to give her her suppositories right there on Main Street.
Oh,
And she was 14 years old. We're like, whoa, 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 let's get a blanket over her. I gotta get this in her. I gotta get this in her. Hold on, man. Yeah. Bless her heart. She finally ended up having to go to a group home in St. Louis because he OD'd one night.
Oh.
Ethical aspects of pre-hospital emergency medicine are classified in 4 groups again. The process before medical interventions, including justice, stigmatization. Oh, that one cut off. I don't have the other 2. Sorry, guys. Okay, this one is going to be a little lengthy. You arrive on the scene of a single vehicle MVA with 2 passengers. Driver is a male in his 80s, and you can see that he requires immediate transport. However, he doesn't seem concerned about himself. Instead, he keeps asking about his passenger, his wife, who has died. What do you tell him?
telling the truth.
I totally agree.
You just tell them to go to the pearly gates, and if they don't come with you, they'll be there soon.
You
You
know,
might not know this. You
Yeah.
say that.
this, one of the first calls I ever ran on was Christmas Eve. And a drunk had hit a family that I knew, went to school with their boys. Got there, and I tell you the name, Mr. John was sitting there in the driver's seat. And I ran up to him, I was like, Mr. John, you okay? He's like, no, son, I ain't. I said, what's going on? He said, look in here. Well, I took the flashlight and looked in there, and Mr. John's torso was sitting in the seat, and his hips and everything else was in the floorboard. He'd been cut in half. His wife had taken the hinge off the hood, it impaled straight through the chest. She was dead on arrival. Told us, Mr. John, we're gonna get you out of here. He said, no, son, you're not. He said, I'm going. He said, Ellie's gone. He said, I got my boys. He said,
Where were the boys?
they were at home.
Oh, okay.
And he said, there's nothing you can do for me. He said, just stand here and talk to me, okay? So I stood there for about 15, 20 minutes talking to him. We had a state trooper out there. Didn't care. He wanted the driver met. He grabbed the driver of the other vehicle and brought him up to the car. Was it ethical?
Probably not.
He was a state trooper. I don't care. He grabbed him and shoved him in that window. He said, I want you to see what you done. He said, look, no. He said, look, or I'm going to bust your ass. And he's like, now you remember that Merry Christmas and stuff that's in the car. So I sat there and talked to Mr. John until he passed away. We got the roof cut off the truck, got them both out, packaged, and the coroner showed up. That was kind of rough.
Yeah.
Because, and went to the hospital afterwards. We had to go get supplies. Walked through the ER door, and who am I standing there? And y'all, I wasn't much smaller than I am now, but John Jr. and Basil, their boys, made me look like Shanghai. They were both about 500 pounds, about 7 foot tall.
Full grown though.
They were 18 and 17.
Oh my goodness.
And I walked in the door, and Basil grabs me. He said, who done it? I said, I can't tell you that. He just picked me up. And we started going outside. And I'm kicking. Basil put me down. Who done it? I said, can't tell you. I said, I got a Hippocratic thing for the fire department, man. I can't tell you who done this. We went outside. John come around the corner. And we're both sitting there looking down at me. A little intimidated. Like, wait a minute, guys, we play ball together, we're tight. This is until you tell us. I said, I can't tell you. Plain and simple. Could I have told them? Yeah, it wouldn't have been nothing to me because I wanted to see him get his kid too. I really did because they were a great couple. They really were. They adopted every kid in the neighborhood. You want something to eat, go see Miss Ellie. Mr. John needs to get a bike need fixed, go see Mr. John. He'll fix it up for you and have you new as can be. They were great. They figured out who it was after time went on, and that individual disappeared. Am I ever going to ask him what happened? No. Basil passed away a year before last. He fell off a drilling rig and broke his neck when he landed. I don't think 500 pounds and 7 foot tall should have been on a drilling rig myself, not that high, but he hit the ground pretty hard, they said. I went out for his funeral. John's still doing good, but they still remember what happened Christmas Eve, 1988. He can tell you the phone call that he got. He can tell you who did it, but he will never say what happened. Like I said, he told me, he's like, she's gone, and then I was trying to be the upbeat. No, we're going to get you out. He's like, you ain't get me out of here. Look at me. So yeah, telling them straight out, your loved one has passed, they're dead. A lot of times you can't tell them they passed away or they've moved on because they're not where they go.
You're right.
We had a lady in Mammoth, did not know that she was mentally challenged at all because Randy and I had run on her before. Her husband passed away, and she's like, what's happened to him? What's going on with Claude? Randy said, well, hon, he's moved on to a better place. No, he's right there. He said, well, he's passed. Well, no, he's not moving. What's he passing? He said, he's dead. And then it hit. And Claude is actually buried behind the old Mammoth base. His brother went and got him and took a backhoe and dug a hole in his backyard and buried him. That afternoon. It was like, whoa, okay. Actually, it's legal if it's within 24 hours.
Really?
Yes.
You can be buried in your own yard.
You can be buried in your own yard.
Is there a certain depth?
6 foot, I guess.
All right.
But yeah.
All right.
I don't own any land, so I can be buried in my yard.
The whole no matter where you reside. I will bear you up by the septic.
I live on city water.
Informed consent, patient exercising autonomy can only make appropriate decisions regarding their medical care if they possess enough information to make informed choices. It is therefore the ethical obligation of EMS to present a full and accurate picture to our patients of the risks and benefits of their self-determined healthcare decisions. They tell you they don't want to go, tell them what they're possibly looking at. Can we guarantee it? No, we can't, but there's some that's been in this long enough. They know what's coming. Y'all know what's coming. So try to get them to go. We're there for patient care. We're not there to get AMAs. AMAs don't mean nothing. It means you can fill out a piece of paper. Confidentiality. We all know about HIPAA. A violation of HIPAA can result in $5,000 per or $50,000 per infraction with a maximum penalty of $1.5 million per year. They can do that for 3 years. So that'd be $4.5 million.
Cool.
Yeah, I'm going to prison.
Yeah.
The term beneficence describes actions which are carried out for the benefit of others. Administering D50 to a hypoglycemic patient while on scene, instead of immediately transporting them to the hospital while unconscious, is an example of beneficence in EMS. In this situation, providing IV dextrose with the knowledge that the patient could very likely return to consciousness and be left safely in their home is beneficial in terms of lower cost to the patient and less of their time wasted waiting in an unnecessary ER evaluation. Non-malfeasance, I'm not even going to try to say this Latin word. First, do no harm is what it translates to in our language. The original guiding principle of medicine, if faced with a choice between doing nothing or taking an action which will cause more harm, the correct decision in most cases is to take no action. Similarly, if infraction would likely result in harm befalling a patient, EMS providers are obligated to take appropriate steps for protection of their own care. So, justice, as it pertains to healthcare, justice refers to the level of fairness by which medical services are distributed. In EMS, medical care is provided on an emergency basis equally to all persons, regardless of race, sex, religion, socioeconomic status. Systems of triage also observe the ethical principle of justice when determining each patient's priority for care depending on the urgency of their needs. Respect for persons to simply tend to an emergency medical need is not enough. Patients must be afforded basic human dignity and respect. In our often dark and gloomy profession, it is easy to fall into the trap of viewing our patients as cargo to be transported. This is a natural psychological self-defense reaction, which EMS providers must guard against in order to maintain ethical healthcare practices. We all have those frequent flyers. Oh, it's just so-and-so. This is going to be another ride to the ER. We'll have to take them back. There's not a person one that don't fall into that trap. So just try to keep yourself out of it. Honesty, EMS providers must be truthful in all dealings. Lying can at best destroy any trust between EMS and the public, and at worst result in legal ramifications to the provider and the agency. Honesty must be exercised in our documentation and in our direct communication with patients and other healthcare providers. Integrity, an EMT or paramedic with integrity adheres to ethical principles despite any pressures or temptations to do otherwise. The provider must always stalwart in the face of challenges to their ethics and make any decisions which they know to be good and true. And number 10, advocacy. One of the best ways we can care for our patients is to be their advocate. Advocating for a patient may simply entail making phone calls to coordinate assistance for them, contacting their primary care physician to help clarify any confusion the patient may have about their doctor's instructions. In some situations, the patient may be unable to advocate for themselves at all, such as in cases of child or elder abuse. And it becomes the legal and ethical responsibility of the EMS providers to advocate for the patient's safety and well-being. Not because he's my partner or because he's a brother to me. Randy Fowler is one of the most helping and caring paramedics I've ever seen on a call. It can be a low blood sugar. Well, here, just a minute. I'll get you, let's make you some sandwiches and stuff. If you don't want to go with us, you don't have a ride.
You're making sandwiches next week? Is that what I'm hearing?
I will if you want me to. I have seen Randy go in and cook breakfast for people when we showed up on their scenes. You know, it's just real hard to find anybody to compare to. He has taught me a lot over the years. When the original idea was to put me with him to settle me down, yeah, it kind of backfired because I just fired him up. How that turned out. Folks, that's what I have on ethics. Does anybody have any questions, comments, suggestions, things you'd like to talk about on calls where you didn't think something turned out very ethical? I would say people you think that needs to take this class over again, but you know, we ain't got that kind of time today.
I was just sitting here thinking that's probably me, but because I've missed,
Sure.
Ethical. Not always. I think I say die a week later.
Mr. Conyers, you got any input on this from your pastoral side of this and your healthcare side? My meathead, wake up.
While we're waiting on him to reply, I know something that I'm a big advocate for, and I know most of us in EMS, we all understand the same thing, but I think that we could do a much better job just with compassion and empathy toward our family members when we respond to scenes as dying with dignity. And you know, the ones like we were talking about earlier that the family members that trump the DNRs, is that if we concentrate more on explaining things, especially when we're on scenes, and we did the 20 minutes of the horse and pony show, and we do better, or the suicidal ones, which are really more difficult than Meemaw that's, you know, 80 and at the end of her life. Is just trying to talk in a more compassionate manner, and to which, I mean, we can put ourselves in their shoes, but to try to get them to be more comfortable. Because at that point in time, who's our patients? Is it really the person on the floor, or is it the family members?
Right. I'll be the first to admit I suck at compassion because this job has made me dead inside. Seriously. You know, I have to really reach deep to find it.
Yeah.
You know, I'll be sympathetic as I can be with them. But for me to honestly, you know, well, you know, I'm really, really sorry about what happened to you. And I'm like, sorry, folks. And, you know, I'm dead inside. I pray about it. I'm not trying to get into religion or nothing, but, you know, I pray about this night. You know, open me up where I can feel things again.
I've had to too. I used to have a really bad problem with like drug addicts just in general, and trying to find empathy and compassion for them in their situations.
These system riders that, you know,
Yeah.
I call them, you know, every one of them that I pick up, you know, well, I'm disabled. What are you disabled for? Well, my dad spanked me as a kid.
Yeah.
Okay, I just call that learning. I learned not to do that again, you know, after Dad smacked me once. You know, you got people like Gary Moore missing 2 legs and 15 heart stents and couldn't get disability for nothing and
Yeah.
give his life out here on these ambulances.
Yeah.
And oh no, there's something he can do. He don't need disability. And you know, man told Randy one time we was taking him to Little Rock. That's what he done for a living, was he was the disability approval person for the state of Arkansas. He told Randy, he said, "How long you worked?" Randy said, "Since I was about 10. He said, "Odd jobs here and there." He said, "Then I went to work at the feed mill." He said, "You'll never get it." He said, "Why?" He said, "Because you worked all your life, son."
Really?
He said, "They know you will find something to do to make sure you provide for your family."
Wow.
He said, "These ones that I had," Terry and I took a kid one day to Memphis, VA. He had lasted 2 weeks in boot camp because they yelled at him that he had PTSD. And he was hollering and cussing at her as we were going down there. I finally pulled that truck over and I was like, "Look, Jack, this ain't happening." "Well, I'd calm down if I could have a cigarette." I said, "Well, you're an ambulance, you can't have a cigarette." So we're going. She's like, "You got a little upset." I said, "I was fixing to pitch him off Black Rock Bridge. Cotton on."
Yeah.
No little 19-year-old that couldn't last longer than 2 weeks in basic training is going to sit back there and talk to you like this. I used to have a bad temper. I don't think I do anymore. I think my medication.
Me Brambles.
I think my medication's got me controlled.
I am calm, cool, and very, very collected.
Yeah, but you can go rope a cot in about 2 seconds.
Don't piss me off. But yeah, wouldn't you?
All right, I guess nobody has any input or any questions, so we're going to move on to professionalism, which is something I greatly lack.
Conyers did remark. He said he didn't have a lot, but he said, "I'm glad you explained being plain, as in they passed, etc. As far as compassion, there is a difference in showing compassion and letting people walk all over us," which I think that we do quite a bit.
Definitely.
Um,
Thank you. Yes.
Prayer, I look for opportunities from the patient. I pray a lot, especially our hospice patients. I pray for them pretty
Oh, yeah.
often.
It ain't no feather in my cap, but I pray for each after we pick them up. So,
I start praying as soon as we leave,
oh, I do.
and
Just
from here.
give me sharpness and the ability to
Yep.
get served.
And I have to pray over every IV stick. I mean,
Yep.
just to be honest.
Okay, folks, this next part, get ready because it's going to be boring and exciting, and it's on professionalism. And y'all got the way wrong person teaching this class.
I pray we get canceled.
Lord, let us hear 1022 from somebody. Be it first responder, dispatch. You, Almighty, let us hear it from you.
You give them back.
Yep, I
Professionalism.
pray for them too. Okay, professionalism in emergency medical services is characterized by compassion, respect, and commitment to excellence. I fail at all 3 of those. It is also being accountable to patients, the public, and the profession. Professional behaviors: be respectful, treat your patients with dignity and respect, even when they are difficult. That's rough because everybody gets in their feelings, those that have feelings. And, you know, you can talk about me all you want. You're going to talk about mama. That's it. We're fixing to fight. So you got to catch yourself every now and then. Be compassionate. Provide emotional support to the patients who may be in distress or life-threatening situations. Folks, we're not seeing them on their best day. We're seeing them at their worst times usually. You know, nobody wants to be in their late 60s, 70s, 80s, and, you know, you're walking in, 2 complete strangers are walking in because, you know, you've soiled yourself because you didn't get to the bathroom in time and you've fallen and busted your head open. And that's not a happy day for anybody. Kind of looking forward to it, but it's not a happy day. Be competent, demonstrate knowledge and skill in your work. don't sit back there and fumble with stuff and flip out. Cause they just look at you like, okay, can we get somebody else next? Cause they're scaring me. Ethical, follow ethical principles like beneficence, non-malfeasance, autonomy, and justice. Them 4 words keep coming back.
Well, I find it I guess I'm still, mentality of a 14-year-old. When I look around for the adultiest adults and I'm the adult of the situation, yeah, it's like, who's lacking here?
Oh, looks like I told you the other day, when I'm the calm one in the situation, you know things have done got bad.
I just thought nobody was in the way when I threw the Lucas.
Accountability, we live in a world today where nobody, and y'all that are under 30, do not take offense. I do not mean anybody in this profession.
30. Yeah.
Yep.
30?
Well, thank you.
All of these little goofballs growing up, they're not held accountable for nothing. They ruined that when they
Okay.
started handing out participation trophies.
I can be of it.
To get a trophy when I was in school, we had to bust our ass for whatever we were doing. Nowadays, you just sign your name on the list and you get one. So accountability is a big thing in this. You have to be responsible for what you do. Don't pass it on to the other crew. Don't pass it on to your partner. If you did it, man up and own up. Plain and simple.
Yeah.
I'm gonna laugh when she moves you. Then I'm gonna sell tickets for next too. Be a team player. Work well with other members of your team. Great man once told me there is no I in team, but there is a me. Be professional in your appearance. Keep your clothing neat and clean. I'm the way wrong one to be talking because I can get dirty walking through a funeral home. I'll come out with grease on me somehow. Be aware of your regulations. Follow your HIPAA regulations when dealing with the patient information. Time and time again, we'll pull up to a hospital with a family member and somebody will walk up out of the parking lot. Do you have Betty Jo Smith in there? I'm sorry, folks, I can't tell you that. Well, they stand there when we unload her. They're like, well, why couldn't you tell me she was there? There she is. Not allowed to. Professional skills. Be a good communicator. Be able to communicate clearly and remain calm in stressful situations. We all do that. Be flexible. I ain't been flexible since I was 22. The old body's just stiffening up. Be patient. Be able to remain calm and patient. I have trouble with this one, and it's just myself. I pray for patience, and we end up running our butt off. Me and God are not on the same vocabulary level here. Have confidence in your abilities. Okay? You miss an IV. Oh, well. Try for the next one. It happens. Not everybody gets 100%. Don't let it snowball you. Don't flip out. Oh, I'm just not getting none of them today. Well, your patient's going, well, crap, you ain't trying on me no more then. Have good interpersonal skills. Be able to work well with others. Y'all, you don't have to like anybody here. Tim has told us that many times, but in kindergarten, we all learned how to get along.
Don't get me started on that.
I don't want to have to share my toys either. I don't want to have to share my medics, but sometimes I do.
I share my toys. Oh boy. I brought toys.
The importance of professionalism in EMS leadership bears the responsibility of establishing a just culture atmosphere that focuses more on education and mentorship than discipline. None of us like being told that we've done something wrong. I mean, there's probably more crap I've gotten away with that nobody's found out about.
Do you care to share?
Not really, because some of it's still, I think there's,
Investigations out?
Hmm?
Oh, what?
I think there's limits of Yeah.
7 years.
7 years. Yeah, 4 of them I can't talk about.
Murder.
Statute of limitations.
On murder.
How you feel you going?
We pause
Iowa
briefly.
First Responders 2101. I have a collision at 355 Flint Springs Trail. 355 Flint Springs Trail. I can hear a guy in the background. I need somebody to get out there, please.
That's at the end of Flint Springs Road.
Flint Springs, is that what they said?
Trail. Springfield Trail. You turn off Flint Springs, or what is that road? Yeah, Flint Springs Road.
Okay,
Is that a dirt road? or-
Saturday?
Paved road?
Marshall.
Saturday, Flint Springs. Oh, bitch. So keep your chains handy.
I heard a gentleman, I don't get no reporting, but I heard a gentleman in the background say he had a crash, and that's all I got.
Well, we probably just blow off.
Sure you didn't say you had a stash?
Hide the stash.
I just-
Moving along and around.
Hey, just call me.
And four.
Call me out. Call me out.
You can pull me. I didn't throw anything hard at you.
Saying I ain't going to.
Maintaining professional competence, striving always for clinical excellence in the delivery of patient care.
Perfectionism.
Professionalism.
Perfectionism.
Professionalism. Professionalism has significant connections between paramedics working collaboratively in a large healthcare system to meet individual, peer, and societal needs. Professional must have well-established set of personal values, and they're not willing to compromise for convenience or quickness. What does professionalism mean to you? Anybody? This is open to all participants.
I got the text pulled up so you guys can chime in too. Humor at appropriate times.
Yes. I can see that. I don't know how many of y'all ever watch Sleepy
Sleeping
Paramedic.
Medic, yeah.
He got badgered and really and threatened a lot over that one deal that he did to his partner after they responded on the dwarf.
Yeah.
He started playing Blue Eyed Lollipop Guild, and there was people that were threatening him on TikTok and stuff. You deserve to die. You need to be shot. Dude was just having fun. So he quit sharing a lot of his stuff. Randy Gann and I pulled up to the code and loaded Mima on the back of the truck, and my radio was blasted, knocking on heaven's door. It was an accident. I didn't mean I hit the button when we pulled up, but it didn't click off. And we're loading her. Knock, 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 get off.
Well, that's a professional thing, keeping the radio, and I'm bad about that too, keeping the radio turned down.
Yep.
Worse situations don't happen like that.
Professionalism, keep your uniform as clean as possible. Nope. Sometimes we should, dead of the night, we're jumping up and, your shirt may be wrinkled, and try to make sure it's not inside out. And that,
Gentlemen, we disconnected and he's supposed to be calling 911. Hopefully I can reconnect.
Integrity, attention to detail, listen to understand, and not to just respond from Mike.
Awesome. Thank you, Mike.
Can you get a picture of call?
Always ask yourself, are you doing everything you can to see that EMS caregivers are considered professional? We must all take an active part to promote professionalism.
Picking up your trash.
Picking picking up your own trash, cleaning your unit, making sure your unit stays clean throughout your shift.
Well, I'm just talking about like when you're in a house and you're doing a
Yeah,
floor lead or
don't
you're
leave your
doing
trash
a
laying on the
code.
floor,
Yeah,
on the side of the road. And
yeah.
opening up sea collars and stuff. Don't leave that laying out
Usually when
there.
I get back, I'm unloading all the, garbage.
My pockets are big enough, I can hold a whole lot of trash inside of them.
Yeah, we got cargo pockets more, use them. So, David said many years ago, I was transporting a chest pain. My partner turned the radio on. The first song was Highway to Hell, so maybe no radio.
I'm thinking that was me that was with you, David. I'm sorry. But yeah, you're right. Probably no radio is the best call at all. All right, this little next deal here is kind of lengthy, but once I get done with this, we'll talk about it. And then
My
I'll
own first responders 2101 is gonna be a full call. The phone dial, he is fine, he doesn't know why his phone is.
I wonder if he took out the barbed wire fence like Eric and I did.
exactly.
So that brings up, this is kind of funny, that brings up professionalism, our dispatcher that says, hold on, I don't have my teeth. Make sure you have your teeth in.
It's rough. The importance of professionalism and EMS. This is coming from EMS World Online and FirstNet.
You would.
August 2019, when this was released, but I thought it was kind of a neat. Late in 2017, a video surfaced on the internet and quickly went viral. Its premise was simple. A group of Indiana University Police Academy recruits were brought outside by their instructors, made to stand attention, and then endured an arduous torture. Instructors approached each cadet from behind while wielding a squeaky rubber chicken. They held the plastic poultry close to the cadet's ear or face and without any dialogue squeezed the toy. A comical cluck emanated from the chicken. Some cadets stood stone-faced and did not flinch. Others broke into laughter and were compelled to do push-ups. The video was hysterical. There was, however, a far more serious point to it. EMS has long been protected from the same level of scrutiny police officers face. People are generally happy when we show up, like our friends in the fire service. We're the good guys. Yet social media and the ubiquity of video cameras have begun to put us in crosshairs. In decades past, our worst and dimmest could hide in anonymity, collecting customer complaints and having closed-door meetings with management. This was irrevocably changed. In action, every action has thousands of potential witnesses. Our encounters with patients and families are forever preserved in MP4 snippets. We are just as likely to be baited as the police and just as likely to injure our professional image. We have reached a point where it is no longer enough to have solid skills and strong medical knowledge. Professionalism is now a requisite attribute in EMS. The story of Paul Tarashuk is a tragic tale. A diagnosed schizophrenic, Tarashuk was traveling through South Carolina in September of 2018. He experienced a mental health crisis. He was found running around Interstate 95, naked and acting erratically. Someone called 911. The ambulance crew arrived to evaluate him. In the evaluation, captured on a deputy's body cam, shows a paramedic and two other providers attempting to get Tarashuk's name. Tarashuk never speaks a word in the video, and EMS crew frustration grows. They lose their focus on medical care and begin berating him for not cooperating. One provider inserts an ammonia capsule to Tarashuk's nostril and is in a seemingly punitive altercation of his mental status. They eventually ask him if he wants to go to the hospital. He shakes his head. And with that, the crew releases Tarashuk to the deputy. The deputy is subsequently seen on security footage dropping Tarashuk off at a closed gas station several miles from the original call. Tarashuk later wanders back into traffic and is killed when he's struck by a vehicle. The entire incident was a miscarriage of medical care, but the most pressing issue was not that EMS misapprehended Tarashuk's lack of mental competence. It's that several emergency responders treated this man as if he was unworthy of their concern. In the court of public opinion, EMS as an industry could not have possibly looked worse. It is conceivable the providers in this case were suffering from compassion fatigue or some type of cumulative stress.
That's a very real thing.
But that does not excuse the behavior, nor does it repair the broken bonds between EMS and that community.
Well, here not long ago, if you recall, over closer to the eastern side of the state, we had a patient that jumped out of the back of a moving ambulance.
The service you have both.
Yeah, down the interstate
Yes, you did. It was in Searcy.
with a paramedic, both of us know.
I just talked about pulling over at Love's and letting her get out and smoke. And she asked for a blanket, and he turned to get her a blanket. When he turned back around, she waved and stepped out the back door at 70 miles an hour. And when the Peterbilt that was behind him didn't stop in time. So folks, we all need to do better. When we think we're doing good, we need to step it up just a little bit and do better. Because like they said in the little deal there, we're in the world age of cameras now. And you may think that, and this is directed to me as much as it is anybody. You may think, oh, I'm going to zing this one here because I'm tired of listening to him. I'm tired of fooling with him. And the next thing you know, you're going to be on the local news channel. Paramedic, EMT berates elderly gentlemen for, and then, that's your license, your home, your family.
Your reputation.
Your reputation. Well, I could not take until 4 o'clock. This was all I had. I hope Chris feels good about this. I'm sure he could have done a lot better job. So thank y'all. If anybody's got any comments or questions, we'll be here about 5 more minutes. Just please send them in to Tasia or her phone, and we'll do our best to answer. Thank you.
Thank you. Better. Where did it go? Oh. That's all what?
It's in all of the certificates.
That's your mom from last week.
So we're gonna have a certificate.
I'll probably do it Friday or Saturday morning. Thursdays are usually chaotic for me when I just.
So I can just take pictures of
Yours should be from last week. That could be in your box. All right, guys, lady, we're gonna call that a wrap.
But that's all, folks.
We will see you tomorrow.
them.